Our first community conversation, we're joined by Dr. Craig Portell, a hematologist and oncologist for UVA Health. He's sitting down with Aaron.
Dr. Portell, it's good to have you here today.
Thanks for having me.
You're very welcome. So today we're talking about Blood Cancer Awareness Month. So there are several types of blood cancers, but what are the most common ones?
Yeah, so blood cancers are disorders of course, the blood system. Think of them as immune system cancers is kind of one way to consider them. There are many different kinds. Some of the most common would be things like CLL, lymphoma, CLL being, chronic lymphocytic leukemia. There's also acute myeloid leukemia and multiple myeloma are probably the most common forms of blood cancers, but they can really present in many different ways.
And is there anything people can do to reduce their risk for these blood cancers?
You know, honestly, not really. We do associate some blood cancers with some environmental exposures, particularly chemicals such as benzenes and other organic solvents, although that's an exceedingly rare amount of patients that would have those exposures. Other things such as pesticides have also been associated with certain types of blood cancers, but again, very rare, nothing in particular that people can do to help prevent getting blood cancers, unfortunately.
And what are some of the most common symptoms of blood cancer?
So it depends on the type of blood cancer. You know, the general types are leukemias, lymphomas, and myeloma. Leukemias can present very quickly and insidiously, if you will, with very fatigue, bruising, bleeding, rare infections can happen with some of these patients who have really abnormal immune systems is really the main issue. For lymphomas, they can present with things that we call B symptoms, which are fevers, chills, sweats, or weight loss. They can also present with lymph nodes that are swollen for unclear reasons. Things like multiple myeloma can present with a lot of bone pain or anemia and other abnormalities in the blood system.
And what about treatment? There's treatments available, correct?
Of course, yeah. Some of our cancers are even curable. Some of the earliest success stories in cancer treatments are really in the blood cancer world. Things like acute myeloid leukemia, ALL, were some of the first cancers that we've cured, and Hodgkin lymphoma are some of the first cancers that we've cured. Now we do have many different treatments. Most of them focus on chemotherapy or immunotherapy, and sometimes the goal of treatment is to cure, and sometimes the goal of treatment is to control symptoms in more chronic diseases with sometimes even just pills that really target the growth of the cancer cells themselves.
And I'm guessing that's an individualized thing. It varies by patient, I'm assuming.
Very much so, by patients, by disease, by characteristics associated with genetic changes that happen that make the cancer happen. So there are many different factors that influence the treatment decision.
Well, I'm glad to hear treatment is available and cures in some cases.
Yes.
So that's wonderful.
Yes.
Well, thank you so much, Dr. Portell, for coming in today. It was great having you here.
Thanks for having us, and appreciate it.
You're very welcome. We'll see you next time.
Thank you.
Steve, over to you.